Good afternoon, and thank you, Dr. Bettinelli, for that introduction to this really important topic. As the Medical Director for Health Solutions, I have the privilege of overseeing a program that follows high-risk and new moms who deliver at a Northwell facility. I do this work in collaboration with the OB/GYN service line, Cohen Children's Medical Center, the Katz Women's Institute, and the individual hospitals, including LIJ Medical Center. We are all on a journey of excellence, of making sure that every mom who comes through our doors is getting equitable, just care that is patient-centered. And because we are so patient-centered, we understand the importance of the stories of patients, specifically the stories of women who interact with our health system. It's through this work that I have the privilege today of introducing Michelle, who was in our Mom's Navigation program and delivered at LIJ Medical Center. And I just am so grateful, Michelle, because as we are on this journey for excellence, we are only going to get there if folks like yourself can be brave and share your stories and your experiences. So, Michelle, thank you so much for being here today, and welcome.
Thank you. Thank you, Dr. Brown.
Michelle, can you share, just if you could share with us sort of your journey and your story? There are many people who are listening in today who really want to hear what you have to say. So if you could sort of take us through kind of your experience, that would be wonderful.
Okay. So I'm going to start with my pregnancy. A little bit further back. I lost my parents. First, it was the end of November, 2018. My mother passes away, and 8 weeks later, my father passes away. Had a very difficult time, my family and I. And now we fast forward a year later. We mourn, we grieve. It was very difficult. I come to find out that after losing my first two loves, I'm now pregnant. And I'm 8 weeks pregnant. And then I have another sonogram and I'm carrying twins. Needless to say, my entire family was extremely happy, and we felt this was a blessing after losing the two most important people in our lives. I was seeking care, being taken care of. I'm a high-risk pregnancy. I'm in my 40s. I have diabetes. I have high blood pressure. And now I'm carrying multiple twins. Now my pregnancy is going along, and going to my appointments. I become 17 weeks pregnant and my water breaks. Of course, I went to the facility that I researched. So I went to LIJ Katz. And upon getting there, I'm evaluated, and myself and my partner were there. And, this is the beginning of COVID, because this was April of 2020. And we were in the height of COVID at that time. And we're there, and this confirmed that I was ruptured, and they gave me my options. And my options were that I needed to terminate my pregnancy and induce my labor and deliver. I proceeded to ask the providers taking care of me, do I have two strong heartbeats? Yes. Am I open or closed? Am I dilated? They told me I'm not dilated, I'm completely closed. Do I have an infection? Do I have a fever? All of the things that I thought would indicate a need for me to deliver my babies. And everything they answered, no, that's not a problem. That's not a problem. The only issue was that I broke my water. I was scared. My partner was there. He was scared. And as I spoke to them and I said, but wait a minute, if I have two living babies inside of me and I don't have any other issues except my water breaking, why do I need to terminate at this point in time? And I was spoken to and I was told all the risks that I'm going to die. I'm going to end up in ICU. I can bleed to death. I can have an infection. I was told every morbid way that my life and the lives of my babies would turn out. And I couldn't understand. So I asked the questions again, and they were like, no, this is the best option for you. This is all we can offer you at this time because your water broke, and that's it. I, in turn, when I realized that they weren't hearing what I was saying, they weren't listening to what I was saying, I asked them, can I please have an official sonogram, and can I speak to a specialist? Call an MFM. They left, they came back. They said, okay, no problem, but we're still going to admit you. As they were saying this, they continually had the discussion that what my options really was, that I needed to terminate my pregnancy. And I just couldn't believe what was happening. My partner was afraid. He thought, Michelle, are you sure? We can't lose you because we have another daughter at home. And he was like, Michelle, don't do this. I know you want these babies. I know how you feel about them, but we can't lose you and lose them. So that's how my pregnancy started.
Thank you so much for sharing that. If you can then sort of take us through, it sounds like you did a lot of self-advocacy. You asked a lot of questions, and maybe you can share with us why you knew to ask those questions, and then what kind of ultimately happened, both good and bad, once you had some of those questions answered and you had that sonogram, and I think a pretty special interaction with some of our providers.
Okay. I did ask for the official sonogram, and I found it strange that no one asked me anything else. No one wondered. It didn't bring about a different dialogue where they were thinking, this person is asking, about the babies, about a heartbeat, about if she dilated, if she's bleeding, if she has an infection. And the fact that I asked for an official sonogram, when they already did a sonogram at the bedside, the fact that I asked for an MFM, who's a specialist in maternal fetal medicine, why no one stopped to say, why is she asking these things? Does she know something? Is she speaking to someone? Does she just Google a lot? What is it? No one came back and had any other discussion with me, except when I waited for the sonogram the next day. The chief resident came back to me at 6:30 in the morning to then speak to me again, stating the same risks, the same problems, the same issues. And I couldn't understand. I thought we had an understanding. I was going to speak to the specialists and certain things were going to happen. And they just still didn't listen. They still kept talking about, you're going to die, you're going to bleed, you're going to end up in ICU, you're going to be in a coma. Needless to say, when my sonogram happened and the MFM came to me, I didn't have high expectations. I felt like I've been fighting. I'm fighting for the lives of my babies. I'm fighting my support person because he thinks that I'm just being selfish for the babies inside of me, and I'm not thinking about myself, him, or our daughter. And I'm fighting my own fears. But that's not what happened. My sonogram happened, and here enters this gentleman, Dr. Deepak Nanda, and he was amazing. He was amazing. He took over the sonogram, and he took care of me, and he found things interesting. He never spoke to me as just a diagnosis or a situation. He looked at me as a person. He spoke to me and he spoke of what was happening with my body. He spoke to me and said, well, you know what? You did break your water, but it was only one sac and the other sac is intact, which means one baby, the water's gone, the other baby, the water's still there. He spoke to me and he started to tell me like, this is tricky. You're not what they call viable. My babies won't survive if they come out now, which I already knew. And I knew this because I'm also a nurse. And I never told anyone this. And we're still speaking. And he came up with a plan. And he talked to me and he says, well, if you continue with this pregnancy, this can happen. But you have to get to 25 weeks. You're going to be viable at that time. But it's a long road. You have 7 to 8 weeks to get to, and he was amazing. And he spoke to me and we set out a plan for the next few weeks of how we're going to progress and what we're going to do. And it was amazing. And if it wasn't for him, I wouldn't have gotten to where I got. And I wouldn't have my daughter at this time.
So Michelle, thank you so much for sharing that. We're on this path to be better. Can you, just in your own words, what are some ways that as a health system we can do better? What should we be doing more of?
I think like the way Dr. Nanda, he looked at my situation, right? But then he was able to separate it and actually treat me according to that and say, okay, she may be ruptured, but that's not her only option. There are other things. He was able to discuss a plan. He was able to empower me and make me a part of his treatment plan. Bring me in a part as a treatment team. A lot of times that's what we do. You form a treatment team and a treatment plan, but a lot of times you forget to include the patient. And that's an integral part of what we need to do. And if we did that more, we would have different outcomes. We have these biases toward people, whether it was like, oh, she was pregnant and my pregnancy happened naturally instead of IVF. Was my pregnancy not important because I didn't pay thousands of dollars to become pregnant? Was my pregnancy not important because I'm older and I should have known because I have comorbidities that, oh, well, she should have known. She has high blood pressure. She is diabetic. She's an older woman. It probably wouldn't have lasted anyway. She should have known these things. Why was it because of my race? Because I'm Black? Who knows? But at some point in time, no one thought about me as a person. They just looked at me as a situation. And that's the problem. And that's where we need to change the way we practice and the way we move going forward. That's what I believe.
Tell me a little bit about how Mackenzie is doing.
Mackenzie, she is a firecracker. She's great. If you look at her, if you see her now, you would never think she's a preemie baby. She came into this world at 1 pound and 14 ounces. I held her in the palm of my hand like this. And now she's almost 25 pounds. She's 15 months old. My due date was October 5th. And I had her and my son on June 25th. So, but she's amazing. She's amazing. She's thriving. She's standing up. She's blowing kisses. She's clapping hands. She laughs. She has an infectious smile. Preemie life is hard. It's hard, but she is a true champion. And if I had listened to what I was told, I wouldn't have that beautiful, beautiful baby to hold and kiss and just be an integral part of our family and our life.
Well, again, Michelle, thank you so much for sharing your story, and God bless you and God bless Mackenzie. And, and know that in sharing, you are helping us get to more healthy moms and more Mackenzies. So again, I just thank you with great gratitude and humility.
Thank you so much.